So, so diabetic foot, actually diabetic foot is a complication of hyperglycemia over time affecting the neurological and micro and macrovascular system. Hyperglycemia and superimposed infection leading to decreased blood flow, leading to gangrenous changes to the skin, muscles, and the other tissues. And the distal part of extremities, especially lower limbs, are more prone to such changes. So now we have to discuss any what factors which leads to this type of changes in the foot. So number one is a long-standing uncontrolled hyperglycemia, and the person who is taking tobacco and smoking, because smoking is a vasoconstrictor. Actually, nicotine is a vasoconstrictor. So it impairs the blood flow. So it also enhance the effect of decrease blood flow, and also the decrease in derange lipid profile. And if the patient is having the cardiovascular disease, hypertension, and if patient is overweight, so these are the factors which leads to diabetic foot. After that, we have to say about the sign and symptoms. So it is not very early. It is coming at least after 2 or 3 years. If diabetes is not controlled, so that these symptoms are coming very early. But if there is good control, then these symptoms will come. But it will any delay. It will delay more than 10 years like this. So the first symptom are the pain or cramps in the buttock, thigh, calf muscle during physical activities. There may be changing of the color of the lower extremity, tingling, burning, or the pain sensation in the feet. Loss of sensation in the feet may be a symptom. Reduce or absence of pulsation in the dorsalis pedis and posterior tibial artery. So at the every time of follow up, if we examine the patient, we have to see these two arteries for just comparing the blood flow is it good or not. And the other symptoms are the cracked and the dry skin, thickened yellow toenails, the loss of hairs on the feet, toe, and the lower leg because of decreased blood flow. And there may be fungal infection, blisters, sores, ulceration, corn, ingrowing nails, non-healing of a wound, and the change of shape of the foot. It may be changing the slight changing of the foot. It may be the arch of the foot. It may change. Okay. So now we come to foot care. We have to check the feet every day. If someone is diabetic, so he has to take care of his feet very well. He has to check feet every day, and the good washing and the mopping of foot and fingers every day. You never go barefoot outside. Well-fitted shoes and comfortable shoes. And the most important thing is the trimming of the toenail. And the trimming of toenail, it should be straight. It's not really like the very deep cutting of the nail. It should be straight. And don't remove the corn, callus by self. If you have such problem, you have to visit your physician and you get your feet examined regularly in your follow-up. If suppose your doctor is not seeing your foot, and you have to say, just doctor, see my uh, feet if there is any sign of decreased blood flow or not, and promote the feet friendly activity like walking, like cycling. Any the light physical activity is a good for this. Now we come to the treatment part. Once the diabetic food changes are established, we have to start active treatment as early as possible. We can slow down the process by applying the preventive measures, the good glycemic control, and if someone is still diabetic, his his glycosylated HbA1c, it should be less than 7, and the good control of hypertension, good lipid control, proper foot care, and a medication to relieve pain and enhance the blood flow to the extremities, cleaning wound and the draining if any fluid or the pus formation is there, debridement, in debridement of the of the dead tissue, antibiotics to minimize the secondary infections, and prescribing wheelchair and crutches to take away weight to the affected foot. And the most important thing, the balanced diet. Okay, next. So the message is, if you want to have the good foot care, so we have to maintain our good glycemic control and regular physical activity to reduce the incidence of diabetic foot and to prevent from the incidence of amputation. Thank you.